All right, let's welcome our guests. We have a consultant obstetrician and gynecologist, Dr. Kayode Obende. Thank you so much, Dr. Obende, for joining us on Weekend File.
Thank you for inviting me. Good evening.
Good evening. Dr. Obende, it's not a pleasant situation going by what we're seeing, the negligence, medical negligence to be precise. We've seen the stories, some of them which were reported. We're not even talking about the ones that were not reported. What do you make of all of this? Because it's beginning to cause, that eroding of trust in the system.
Well, it is unfortunate that these things are happening, but I must tell you that it's no surprise. I think it has to do with the level of our development. Unfortunately, we expect much more when we have not given the system enough to improve. Now, over the years, we've had situations where health personnel, doctors, nurses, dentists have been migrating at alarming rates, and the response of government have not been adequate in addressing the situations. So where you have a situation where a doctor is meant to manage over 10,000 patients, you are expected to see over 50 patients within 1-2 hours. A lot of things can go wrong. You have a situation where some staff work 48, 72 hours non-stop. And definitely they must be stressed. You must have the burnout syndrome. And these situations are prone to, mistakes. So when errors occur, we need to sit down to address the reasons for these errors, not naming and shaming the individuals. It may be from the individual, it may be from the system. Definitely, I can tell you that the system has a lot to do if we need to improve on the system.
Okay, Dr. Obende, you've mentioned systematic issues, but again, let's look at these medical practitioners whose, lives have been entrusted in their hands. And most of these cases, the critical ones, so to say, are the ones during surgical operation. Now, during surgical operation, if I understand, it's not just one doctor you have there, you have supporters there, which are the nurses and all of that. So what could have gone wrong in a situation like that? We're not talking systematic now, we're talking individuals who are in charge of that operation.
Now, an operation is usually done by a team. In that team, you have the lead surgeon, you have the assistant surgeon, you have the nurses. Each of them have specific roles. Now, before you start any surgery, ideally you should count your instruments. There should be an instrument count.
Yeah.
And after the surgery, it is expected that you should count your instruments and the gauze and all those things you use to make sure that everything is complete. Where that is not done, or where there is a false impression that the items are complete, then you have errors. Now, just like I mentioned earlier, a doctor that has been working for 48, 72 hours, that's the level of concentration will definitely be reduced, and so he is prone to errors. So these are the things we need to address.
So what's as the solution recommending if you said a doctor, because that's what we saw in the report, they could be overwhelmed because of low workforce. Now, we're not even seeing these cases in public hospitals, we're seeing them in private hospitals, which we know not too many people visit private hospitals because of the cost, and yet we're seeing this medical negligence. Dr. Obende, are you saying that when such instances happen during disciplinary investigation, the doctor should be recused?
Definitely not.
Okay.
But what I'm saying is that the blame should not entirely go to the doctor alone. The blame should not be on the personnel. The system, you need to address the system. Why should 2 persons be doing the job meant for 20 people? These are the things you need to address. Why should a doctor be on call continuously for 1 month? and you expect maximum, benefit from him. It's not possible. Every personnel needs a period of rest after work. Like if you take the aviation industry, for instance, you don't expect a pilot to continue to fly day in, day out. They have protocols, the number of hours you fly and the number of hours you rest. Unfortunately, because of the economic situations, you find doctors working in multiple centers just to make ends meet. And these lead to burnouts. So doctors need to be well paid, or the health professionals need to be well paid. They need to be well taken care of. Now, if you visit those centers, go and look at the call room of these health personnel. If you do not have a good call room, a convenient call room to rest while at work, there is no way you can put in your best. So there has to be an audit of the entire system, not just the personnel, even the infrastructure, the equipment, and the day-to-day administration of these centers.
Okay, Doctor. All right, Dr. Obende, we saw some of the medical practitioners there singing the same song of overwhelming situation. Excuse me, when you have one doctor to how many patients? Beyond that, I know there's the ethical principle that has to do with integrity, transparency, accountability, Dr. Obende, when a life is entrusted in your hands.
Okay. With this atmosphere we work in, the conditions under which we work, you know that we are doing more than it is humanly possible. Now, we don't have a situation where a doctor can say, no, I can't handle this case. For all you know, you may just be the only one in that environment that can attend to that patient. So even though you are stressed, even though you think you are not really up to it, you just have to get involved and do your best. And sometimes these poor outcomes, results. Now, it's not every case of poor outcome that is linked, that you can link to medical negligence. But in our society, my experience is that everyone wants a cause for something. So they must link it to something, and who else will they link it to? Is the staff. Now, we should realize that in Nigeria, in Africa, we have very poor health-seeking behaviors. We wait until the last moment before we go to the hospital. Whereas in developed society, they go for routine checkup. Even if nothing is wrong with you, you just walk in there, go for routine checkup. Okay,
Dr. Obende, let me come in there. It's good you brought out this point of, I'm not saying the individuals still don't have their own, concerns. But in a situation, we saw the Kanu situation where a Caesars was left after surgical operation. And then I saw a video, very gory. A towel was left inside the woman, and she was complaining of the same abdomen. So would you say it's a case of the individual now coming late?
Okay, it's still related to what we have been discussing. These healthcare professionals are humans. They are not perfect. They are prone to errors. So what we should be looking at is how to limit the errors they can make to the barest minimum. And you don't expect the errors to be reduced if somebody works for straight 72 hours. You don't expect the errors to be reduced if somebody is operating on you and is thinking of how he's going to pay his debts, how he's going to pay his children's school fees, how he's going to provide food at home. These health personnel need to be well taken care of for them to give maximum outputs.
And if the health practitioners are well taken care of and we see cases like that, I'm sure we have regulatory bodies who are expected to ensure accountability is ensued. Dr. Obende.
Yes, the regulatory bodies, I think they are doing, well, they are doing their jobs, but maybe they are not as effective as they should be. But like I said, you don't expect the regulatory body to be very high-handed on the personnel when they know that there are other issues contributing to these problems. Now, even if you go to these regulatory bodies, what is the funding like? They are not properly funded. Sometimes they want to go on inspection, there is no vehicle. So these things, like I said earlier, we need to sit down, appraise the entire sector, and then provide solutions. But unfortunately, like most Nigerians, what we do is that there's a problem, we try to provide our own personal solutions to these problems. If the Nigerian hospitals are not working, I can go abroad. All our leaders tend to go abroad for they just sneak out for their own personal treatments, leaving the other Nigerians to the problems we face. I think we need to sit down, just like it was mentioned in the report. We should know that healthcare is not about the building. It's not about renovating and painting buildings. Equipment, even if you provide the equipment and there are no personnel to manage those equipment, it still comes down to zero. Okay. So we need to sit down, appraise and reappraise the entire sector.
Okay, so Dr. Obende, I'm sure you're aware that some of these medical practitioners have been found guilty based on investigations because some victims or maybe those who have victims are seeking legal recourse, and we're seeing investigations carried out. We saw the case of Kanu that 3 doctors were found guilty based on the report. Now, I want you to speak on the aspect of training. In as much as a medical practitioner is overwhelmed, does that give the person, a validation to excuse whatever error that has happened? What happens to the place of training for these personnels?
Okay, we are not in any way excusing the errors. The errors are there and they are unfortunate. Now, when you come to training, this training, the way training in medicine is, or in medical practice is that the elders pass on their knowledge to the younger ones. Now, if you have a professor, if you have a consultant who should be in the clinic training the younger ones, if you have him in one other private center looking for money and looking to make ends meet, definitely it will affect the level of training the younger ones can receive. And that is part of the problem we are having in our society. Sometimes you find consultants who come out and they cannot do the basic things that is expected of them, things that they should have learned while in residency. You still find out that they come out and they are not capable of doing it. So by the time they become consultant, that's when they now start to acquire these skills. This should not be. But like I said, if you provide an enabling environment, I don't have to work in 6 places before I can provide for my family. I'm dedicated to this center, to managing patients and training the younger ones. I think things will improve.
Okay, Dr. Obende, before I let you go, I'd like you to, you're still having your years of experience, and I'm not sure you want to find yourself in a position where you'll be caught wanting when it comes to such negligence or human error. What would you say to medical practitioners? We commend their efforts, their dedication to service, but again, we should also paint that picture of what is wrong and what is right is right.
no doctor will be proud to say he left his scissors in a patient. No doctor will want to be involved in any case of negligence. So we pray before going to work, we pray before starting any procedure, and as much as possible, we try to follow the SOPs. Now, sometimes things go wrong. It's for you to be able to identify the problems and sort them out. Now, I will advise my colleagues to say, when you are tired, when you are burnt out, take a rest. Go to your MD, go to whoever is in charge. I'm not up to this. I need a break. Now, you know the funny thing, if you are head of department and you're a doctor under you comes to you, say, Chief, I don't think I can work today. You say, please go and continue your job. But another person, not in the head, maybe a teacher comes in, doctor, I need 5 days off. We are quick, very easy to give them excuse duty, but not for health workers. We push ourselves to the limit, and then we work under very stressful conditions. And you cannot really blame the administrators because the numbers are very limited. So government needs to do a lot. Provide the enabling environment. Let us keep our doctors at home. And the only way you can do it is correct remuneration. Now you have a doctor or a nurse leaving this place, crossing the borders, and is earning 10, 20, 30 times what you are offering him here. How do you solve that challenge?
All right, Dr. Obende, that's a discussion for another day. The concern here is that no life should be lost based on negligence. Thank you for coming on Weekend File.
Thank you very much.
We do appreciate. All right, let's take a break.